Morning, welcome to another Thursday Q&A, and today's question is, I've been told I've got arthritis and there's nothing I can do about it. Now this is really common and it can affect any joint, knees, hips, shoulders, ankles, you name it. And people often either come with a scan or during the process they've maybe had a scan and it's come back with some wear and tear, some osteoarthritis, and they've been told or they believe there's nothing to be done because it's just wear and tear. Now there is absolutely things that can be done with arthritis, and what I'll do is I'll use the knee for an example because it's one of the more common you'll find. The first start is physio. So physiotherapy is one of the first things you need to try and does have a dramatic effect in reducing your symptoms at the very least. Now, yes, we're not going to change the actual joint itself if you've got some wear and tear in there. We're not going to suddenly regenerate that. But there's loads of things we can do, and typically speaking from what I would look to do, or what we do in clinic here, is obviously full assessment first, but then soft tissue work. Controversial maybe for some people, but working the soft tissues, one, it can help reduce your symptoms and reduce pain. It can help you regain some range of movement, and then that allows us to then move in to the loading and the gym work and the resistance training and the strengthening of all the muscles around the knee, which can have a really positive impact on arthritis. If you've tried conservative management, such as physiotherapy, and you're either not getting anywhere or your pain's getting worse, the next thing to do is ideally with like an image, so confirming, or if we've already got one, have a bit of a deeper look and understanding of where the arthritis is. So if we take the knee, often we'll just be told we've got arthritis, wear and tear. However, knowing where that is will give us some options in terms of treatment plans going forward. So it may be the lateral compartment, it may be the medial compartment on the inside, it might be the patellofemoral joint. It can be a combination of all three, but knowing which one can give you some ideas as to how you can approach either changing your approach to conservative management or some other options going forward. Now, usually if you're NHS, you might be offered a steroid injection, which can be really helpful in terms of reducing pain. It's really important that you then follow that up with your rehabilitation. It's a window to try and get you pain-free to be able to load that joint. When it comes to private options, yes, you've still got a steroid, but there's lots of other injection therapies that can be really helpful for knee arthritis. So we've got things like steroids, but we've also got joint lubricants, things like Ostenils, Cingals. There's hydrogels, like hydroscaffolding gels, Arthrosamid. There's a variety of different ones. It depends who you see as to what they recommend and the potential benefits for either. Relatively non-invasive, obviously, is just an injection. You're not going down the surgical route just yet. They can be really helpful. I've had one myself. I've got no cartilage in the left knee, and I had that about 3 years ago now. I had an Ostenil, and I'm still squatting. I'm doing everything that I can in the gym, and I don't get any pain. Following that, again, knowing where the cartilage issues are will then give you some other options in terms of potential surgical options. Now, obviously, these are last resort. However, if your function is really limited and your quality of life is suffering, then they are something to look into. So firstly, you've got partial knee replacements if it's just a medial or lateral patellofemoral isolated cartilage issue. And then you've also got osteotomies. So they will look at, if someone's a little bit younger and again just unicompartmental, so one compartment, they will look at doing an osteotomy. I won't go into exactly what that is on this video. Following that, you've then got your full total knee replacement. So all in all, there's lots of options you've got to manage your arthritis. Now, I've obviously explained the knee there, but that can go for an ankle, it can go for a shoulder, it can go for a thumb, a big toe. There's lots of options. You just need a good thorough assessment, understand exactly where the cartilage issues may lie within the joint space, and then speak to your practitioner about other options if you feel like you've exhausted all your conservative management options, such as load management, strengthening, and manual therapy. If you've been told you've got arthritis and you don't feel like you're getting anywhere, feel free to reach out. It's really important to have a bit of a network of people, particularly within the private sector as well, that we can refer to, which we have. We're lucky to have that connection with injection therapists, imaging units, that sort of thing, so and consultants to get a full picture of what's going on. But there's always something you can do with arthritis. Don't just let it sit there, don't just rest. There's plenty to be done.